Hello, hope you are doing very well. We are with Dr. Michael Weber. He's the head of the European Laser Academy and head of European American Laser Clinic. There are many patients that ask some questions about cancer treatment, and today I want to ask these questions from Dr. Michael Weber. Thank you very much, Doctor, for coming. What is the difference between the protocol of cancer treatment in your clinic with the other clinics all over the world? Thank you very much.
Yeah, thank you very much for the invitation. Thank you very much for sharing more than 3 decades of experience of photomedicine. What we perform is not a contradiction to what is performed in Western oncology. We try in all our fields, especially in the cancer treatments, to find an integrative approach, to collaborate with the oncologists, with the radiotherapists, and all the doctors that are involved in the treatment. Our basic concept is to pick up the patient at the point where he is. So we start out at the very basic, start out with sophisticated history and examination. We perform what we call mitochondrial medicine. So we look in the precise situation on cellular and subcellular level. We measure for circulating tumor cells. We get the genetics of the tumor cells, so we get information. What's a malignant melanoma is not a malignant melanoma in the other case. There are many differences, just to give one of the examples. Then we culture the tumor cells if possible. And then we make precisely measurements about the sensitivity of the tumor cells. So we look whether they react on the recommended chemotherapy according to the protocols, and in addition we look for what we call biologica that may have an anti-cancer effect as well.
Do you support all type of the cancer, or it's just on, for example, a very specific type of the cancer?
It depends what you mean by this question. Of course, we support all forms of cancer, but there are some cancers with extraordinary good results by what I call Western oncology. So I would deny to go with a protocol that I just outlined briefly. For example, in children with acute lymphatic leukemia, the most common form of leukemia in children, they have a survival rate close to 99% in the 10 years. However, cancers like pancreatic cancer, esophagus cancer with poor prognosis, there we would offer the patient an additional approach. If the patient decides, I want to go for the Western approach, we still can support the patient with our protocol.
And most of the patients ask that what is the procedure for treatment, and they want to know that what are the steps that they are facing to. Can you summarize this procedure, please?
As I just mentioned before, for me the gold standard is a proper history first. Secondary, doing a sophisticated clinical examination. This includes, and we can offer here in this center, not only high resolution ultrasound, but we can offer CT, we can offer MRI with any form of contrasts if necessary. Then we collaborate with different universities to perform what I mentioned, circulating tumor cells, measurement of sensitivity. We do mitochondrial medicine. We check for lipid peroxidation, other stress parameters in these patients. And then we set up an individualized treatment protocol. This may consist of infusions of certain mitochondrial substances, mitoceuticals. This may be that we decide to perform photoimmunotherapy. This may be that we perform what we call photodynamic therapy. So in these cases, we would give an infusion, for example, of curcumin, which has an anti-cancer effect on its own, well described. It enhances the effectiveness of chemotherapy. It enhances the effectiveness of radiotherapy. It prevents the angiogenesis, so the tumor won't grow that much anymore. At the same time, it's a terrific substance to combine with intravenous blue light irradiation. In this case, we induce only in the cancer a photodynamic therapy, an anti-tumor, a tumor killing effect.
therefore, if I correctly understood, you not only have a very specific type of the pre-investigations, but of course you have a very high evaluated laboratory experiment. In the same time, the treatment is different. You have a very combinational methods. And what is about the follow-up of the patients?
I may just thank you for the summarization. Quite often it occurs that we detect one of the recommended chemotherapeutic substances, like adriamycin, etoposide, is very effective in this patient. And these substances we can use as a photosensitizer. So may the oncologist give the traditional substance, and then in the afternoon you come to our clinic and we perform with your etoposide a photodynamic therapy.
One of the patients asked that they saw in many videos of you that are in YouTube Rethinking Treatment channel that you are using very specific type of the treatment, but of course you will go into the root of the disease as well. Is it the same about the cancer treatment? You will go to the, I mean that you will try to treat the cancer and the root of the disease as well in this type of the treatment?
If I get the question correctly, of course, the overall aim is to kill the primary tumor, the metastasis, and even the micrometastasis. With this method, we usually have a great tool to even destroy the circulating tumor cells in the bloodstream. But yes, I'm very thankful for this question. Quite often, by our specific measurements, we detect, oh, the patient is poisoned by mercury, by lead, by arsenic, and then we would, for example, chelate these substances to prevent a recurrence of the tumor 5, 10, 12 years later. And especially when patients receive chemotherapy, they are quite often containing heavy metals, cisplatin, carboplatin. It's very, very valuable to look if there are any lasting devastating effects on cellular level that we could counteract.
And can you use this method for prevention of cancer, treatment of cancer, and even in metastatic cancer, or is just in, for example, just earlier stages? Can you use this method in different stages of cancer?
Yeah, I think this is of course a very, very important question. Let's probably start out with the prevention. We offer a variety of different methods to test at an early stage. We offer the progesterone investment. So by this we can check for the risk of about 18 different malignancies. If this is the case, we would suggest to perform a PET to find out if there is any pathology, or looking for circulating tumor cells and get the genetics and the background of the tumor cells as early as possible. Quite often we find family members that are affected, so we can do really primarily prevention before the tumor occurs. This means we can treat micrometastasis, we can treat circulating tumor cells. And if we go to the end part of it, this is unfortunately still most of the patients we see, they came at the advanced or quite often at the end stage of their career as cancer patients. By nourishing the healthy cells, we can give the patient quality of life again. No oncologist, not our clinic, no honorable medical doctor can claim I can treat everything and can promise everything. But I would say over the 3 decades where I'm working with tumor patients, by this approach, all patients will tell me, yes, we regained quality of life, not all survived unfortunately, but we regained quality of life for the patient and for their families.
Thank you very much. Therefore, as Dr. Weber mentioned, this method could be used as a preventive method, could be used for treatment, and even it has indications in metastatic cancer. If you are more interested to know about the clinic services, please make a contact with Dr. Michael Weber. Thank you very much.
Thank you very much.